There are 14 beautiful, beautiful facial bones. 6 of them are paired and 2 of them are unpaired, for a grand total of 14 facial bones.
The facial bones are the unpaired mandible, the paired maxillae, the paired zygomatic bones, the paired nasal bones, the paired lacrimal bones, the paired palatine bones, the paired inferior nasal conchae, and the unpaired vomer.
These wonderful bones are directly connected to the facial muscles, which we'll talk about later. Those fantabulous facial bones also provide cavities for the facial organs, like the eyes, nose, and tongue. But it doesn't stop there. The facial bones also anchor the teeth and even serve as pathways for air and food.
One of the most important facial bones is the mandible. The mandible forms the lower jaw and anchors the bottom teeth. It's the largest and strongest of all the facial bones.
The paired maxillae anchor the upper teeth and form the upper jaw. They also form the anterior or front part of the hard palate. In everyday life, the hard palate is known as the roof of the mouth, but it doesn't stop there. The paired maxillae also form the inferior orbits. That's the lower part of the eye sockets. They even help form the nasal cavity.
Other important facial bones are the paired zygomatic bones. These bones are the ones that form the cheekbones. Then there's the paired nasal bones. Without these babies, there'd be no bridge to your nose. And let's not forget the paired lacrimal bones. The lacrimal bones form the anterior medial orbits, which are part of the eye socket and, sadly enough, contain the lacrimal, or tear sacs.
Another important pair of facial bones are the palatine bones. You remember earlier when we said that the paired maxillae make up the hard palate. Well, they don't do it alone.
The paired palatine bones make up the posterior hard palate. That's the back part of the palate. The paired palatine bones also make up a small part of the floor of the orbits, or eye sockets. And finally, they help make up our friend the nasal cavity. That's inside your nose in case you've forgotten.
And then there's the unpaired vomer, yet another important facial bone.
The vomer forms the posterior and inferior parts of the nasal septum. That's the back lower part of the little wall that divides the inside of your nose.
Finally, there's the paired inferior or lower nasal conchae. The paired nasal conchae make up the lateral or side walls of the nasal cavities. You got it?
Oh, right, the hyoid bone. There's also a hyoid bone, which isn't officially part of the skull, but is often discussed at the same time.
The hyoid bone is a small horseshoe-shaped bone. It's located inferior to, or below, the mandible, and it's superior to the larynx, or voice box, in the anterior neck. Whew, that was a mouthful. The hyoid bone serves as a point of attachment for a bunch of neck and tongue muscles. It also acts as a movable base for the tongue.
The hyoid bone is a unique, almost sad bone. It's the only bone that doesn't connect directly with any other bone in the body.